slides are available and the link will be posted in the chat box. You can turn off chat notifications. That'd be really helpful to reduce excessive pinging. Other things to say as well, we will be recording the session just so that others who can't make today will be able to watch a recording. We've been putting in the chat box for those who are just joining, just your name, where you're from, your role within NHS, and one of the things that you do to look after your own health and well-being and the health and well-being of others. So I'm Steve Lee, I'm the head of health and wellbeing, and I'm delighted to invite you to the first of a series of quarterly inclusive health and wellbeing community of practice sessions. All of these sessions are designed to deliver energising online events to bring colleagues together as a national community, to create learning and awareness of different cultures and communities in relation to inclusive health and wellbeing. And today's session, what we hope to achieve is an understanding of what a working carer is and the challenges they face, and what support is available for working carers. That was the script I've been given. I'm going to go a little bit off script, which I'm sure may be shocking to some of my colleagues, but just to say that the work that we're sharing today is part of a much wider, much broader health and wellbeing programme. Every event I go along to, I talk about the three kind of priorities that we've got, which are around ensuring that we've got top level commitment to health and wellbeing within organisations, and we deliver that through health and wellbeing guardians who are typically non-executive directors. The next level down within organisations is that importance around line manager and team dynamics, which we aim to deliver through health and wellbeing conversations. And the third tier is around ensuring that staff feel supported through, for example, mental health hubs and a growing occupational health and wellbeing project that we've just commenced. The importance of all of that, when you bring it together, is the role of data and the role of inclusion. So for wellbeing guardians, we're encouraging them to use data, for example, for the model health system, which anyone with an NHS email address can access, and look at wellbeing data that affects their organisation, but to also look at res data too. What's that telling them, and how can they triangulate some of those data points? So res being the workforce race equality standard. The next level down around kind of line managers and teams, how do we ensure that those conversations resonate? How do we make sure they're inclusive and resonate individual and cultural differences? And the third tier around kind of mental health support through the mental health hubs, and through the work we're taking forward on growing occupational health. What are we seeing there as well around, and how do we pick up and respond to, for example, existing health inequalities? So I hope, even though that was off script, it was relevant and helpful to colleagues to kind of set this in the context of where we're going as the broader health and wellbeing programme. I'll hand that over to Wazir, but just a warm welcome to you all. Thank you.
Thanks, Steve. Hello, everyone. My name is Wazir Mohammed, Senior Program Lead, part of the National Health and Wellbeing. And one of the programs I look after is Inclusive Health and Wellbeing, which is all about supporting the health and wellbeing of our staff from strategic purposes, from the inclusivity angle. So, and one of the key aspects is, of course, carers. Hence, today's event is aimed at NHS staff or carers in terms of raising awareness, developing understanding, providing a space to connect, and how going forward NHS staff or carers could be better supported in their roles and their health and well-being. So just a very brief overview of some of the key aspects of inclusive health and well-being. There's a number of different services and support offers we have. Some of them very specifically developed as part of our COVID response, and we are continuing with them as part of our generic health and wellbeing support offer going forward beyond COVID. Looking after U2 for ethnic minority staff, this is a one-to-one coaching program, which is available to all ethnic minority staff, where you could book up to 4 coaching sessions with a trained and qualified coach. All the sessions are confidential, and they offer the sessions are offered over 7 days. So the link is in the presentation, which I'll share after the event today. Please go and have a look. Nearly 3,000 staff have used this service so far, and there's a very high satisfaction rate at a number of levels. And this is part of a number of 3 other programs which are not specific to ethnic minority staff, but in the looking after you to family within the primary care setting. Please also have a look at them, especially if you work in the primary care sector. The second service I wanted to promote today is the faith-based, spiritual and faith-based counseling. This is primarily mental health counseling service, but from a faith perspective. And it's a small service and was until last month, it was very specifically only available to staff working with COVID patients, but we have expanded the criteria a bit. And now if you are working in a patient-facing role, you could access this service if this is something you want to access from a faith perspective. Again, the link is in the presentation, and from there you could go on a book. Skills for Wellbeing Coaching Train the Trainer program. We are about to, it will take another month or so. This is basically supporting NHS leaders, managers, and anybody who's in a role to support, find themselves supporting their staff in terms of health and well-being. So this will equip you with a bit more skills in terms of based on coaching principles. And it's a trainer-trainer model. There'll be an expression of interest process through which you could apply. And then sharing of learning of good practice. We are always looking for examples of good practice. So today's event session is about carers. So if you come across anything which has worked for your trust, for your organization, or in your region where you work, please get in touch with either myself or Monica, and would be interested to hear from you. And this could be shared further with other organizations, much wider national scale. And last but not least, right at the end, there's a link to our NHS England's page, supporting our NHS people. I would encourage, if you've not already done so, please visit the page. And from there, you could navigate to a whole host of different other resources and information, which is available, all aimed at staff health and well-being. I would stop there. Any questions, I would be here at the end of the event. And alongside my team. Thank you very much. And I'll hand over to Monica, who would take us through from here onwards.
Hello, good afternoon. Thank you for joining us today at the first Health and Wellbeing Inclusive Community of Practice session. As you know, it's focused around carers. So we understand working carers and balancing those work responsibilities and caring responsibilities are quite hard to achieve. So today's session will focus on working and unpaid carers and the challenges that they face. And we're really delighted to be able to let you know that Paul Castle and Shaheen Coulser from West Yorkshire Health and Care Partnership, ICS, will be presenting how they've worked to support this really important agenda, along with Dr. Raka Maitra. She's a CAMHS, higher trainee and lead for Women in Medicine Carers Network. She'll also be presenting. So I just wanted to start off with some Menti questions, just to get a feel of you know, why you've joined today. So the first question I wanted to ask is what your motivation for joining the session is. If you could use the link that should be in the chat box, or go to menti.com using the code, which is 80792379. If we could have that in the chat box, please, for those that want to access the Menti poll. That's menti.com 80792379, or it should be in the chat box for you. Just give us a moment. So the largest number seems to be to learn about what others are doing to support health and wellbeing staff, to be part of a wider community discussion, to support my own wellbeing, to get updates from the National Health and Wellbeing team. So the highest seems to be to learn about what others are doing to support health and wellbeing. Okay, I think that's enough time for that question. So the next question was going to be, and it may be relevant to you, may not be, but there's a multiple choice one in this, just to make it a little bit more tricky for you. So, have you talked to your colleagues, line manager or direct reports about caring responsibilities? So A would be, let's just give that a minute to move forward. So A would be, no, it does not apply to me. B would be, no, it never occurred to me. C would be in an annual PDR discussion, and D would be in one of my one-to-one catch-ups. So it's good to see that there are quite a few people that have caring responsibilities here. And perhaps there's some that you know, maybe might feel they're able to talk about things more when they see that others have, and perhaps they haven't. I'm going to give it a few seconds more. It's good to see that that's been discussed. And there's one other question. We'll just move on to the next one. And that would be, when you think about unpaid carers, what words do you think might describe their experiences? So you see themes coming out here. Lonely seems to be quite a big one. Overwhelmed, challenging, exhausted. Sounds quite tough. Juggling, stressed. So lonely seems to be quite a key one. It's still shifting a little. Let's give it a bit longer. Rewarding comes up as well. I think we've got a good handle on what this is. Thank you for contributing to this. This is really, really important for us to keep this information and see how we can act upon it. So I'm just going to pass you over to Paul Casson, Programme Manager Unpaid Carers Programme, and Shaheen Coulser, Race Equality Project Manager for the West Yorkshire Health and Care Partnership, ICS. So they're going to talk to us about their Unpaid Carers Programme. Paul has worked as an unpaid carers team in West Yorkshire Health and Care Partnership and has focused out on the rollout of the carers passport and has worked to encourage carers to identify through ESR. And Shaheen has been seconded to West Yorkshire Health and Care Partnership as Race Equality Project Manager for the same programme, Unpaid Carers Programme. Shaheen's working with partners on health equality, working carers and support, identification, recognition even, and overall awareness of unpaid carers agenda. So I'll move over to you guys.
Lovely, thank you very much, Monica. Harriet, take us on through that next slide, please. That's lovely, thank you very much. So like Monica's just said there, we've been working in West Yorkshire, and we've had quite a good setup with the unpaid carers programme. I think there aren't many ICSs that have a dedicated programme for unpaid carers, and I think that is showing from the numbers of carers we've identified and the engagement we've got going on with them, and certainly from that word cloud there, that is exactly how they feel a lot of the time, unfortunately. You know, where we're seeing overwhelmed, exhausted, tiring. That is a lot of how they feel having to juggle work and care at the same time. So this is just going to talk through what we did as a little bit of a project that was part of the health and wellbeing pilot that we did. So we set out to support the health and wellbeing of carers from diverse backgrounds, so specifically focusing on ethnic minorities, working within NHS mental health and acute trusts. So evidence has shown us and is still showing us, so the King's Fund have done lots of work around this, that nearly 250,000 ethnic minority carers juggle work and care in the UK. And we know also from other research that ethnic minority communities are the most likely to encounter discrimination at work as well. Just take us on to the next slide, Harriet, please. Thank you. We know as well, so this is just a little infographic, I suppose, about work and mental health. So mental health disorders, very common. So 1 in 6 adults will have experienced that within the last week. 7.6% of sickness absence is attributed to stress, depression and anxiety. It's a big category for us, and 14.3 million days, working days, are lost per year due to these health disorders. So where we're seeing people that are overwhelmed, exhausted, there will usually come a point, often crisis point, where people, you know, are then off sick for these reasons, and it takes a lot of support and work to get them back to work. And that's ultimately what we want to try and avoid with carers, is to preemptively support them to be able to balance both. Just take us on to the next slide, Harriet, please. So a bit more just around the context here. So these are some of the health inequality stats. So young Asian women more than twice as likely to commit suicide as young white women. Black men 6 times more likely than young white men to be sectioned under the Mental Health Act. South Asian people 50% more likely to die prematurely from coronary heart disease, which is again linked to stress and other factors there. High percentage of smokers with African Caribbeans compared to 39% of white Irish, or 44% of Bangladeshis, and 27% in the general population. Like we say, those 14.3 million days are lost to those 4 common mental health disorders. And just onto the next slide. So the Working Carers Passport we've had rolled out, we launched about 18 months ago. It was just pre-pandemic, so unfortunately we did have a bit of disruption there. We know that 1 in 3 of the workforce are carers. We have seen increased support in trusts, which has been really good. Carers UK have a carer confidence scheme, which I suppose outlines and provides a bit of a framework for our employers to embed that support in various different ways. So we've been trying to encourage our trusts to follow that kind of scheme. We have just had one that has just got the accreditation earlier this year, which has been absolutely brilliant. But we have seen generally low uptake of carers in ESR. So we're using the ESR system to identify them, I suppose, using a tag in there, so that we can see how many we've got in our workforces. The uptake of that has been low, so we're getting low carer declarations and we're getting even lower numbers of people using the Carers Passport. Generally speaking, though, we have had good engagement with trust carer leads, senior support, NHS England as well. Jen, who was supposed to be here today, unfortunately couldn't make it due to caring. We've had really good engagement and senior support from them, but ultimately it hasn't. We haven't seen the 1 in 3 of the carers identified in ESR and coming forward and feeling confident enough to identify themselves as carers. We have got a bit of a pilot at CHFT, which is Calderdale and Huddersfield Trust. So one of their senior team on the board is really passionate about this about carers, and we've got a bit of buy-in from them to provide a bit of a targeted approach in an intervention, if you will, to try and increase those numbers. but ultimately, we weren't seeing them as we'd expect, around 30% of the workforce. Just take us on to the next slide, please. So we set out to, with the project, to provide inclusive health and wellbeing and occupational health practices to our employees. And some of the aims here were to identify and support more of those working carers, especially from diverse backgrounds, to access mental health support through the mental health hubs and occupational health services. Increase the numbers that are using the passport as well, and just further embed health and wellbeing support from those diverse backgrounds and into processes and culture. Like we were seeing there, really pleased to see that lots of conversations are now happening in one-to-ones, which is really good. So we're trying to embed it into those existing processes as much as we can, so you have those regular check-in points for carers. And just on to the next slide, please. So we set out and did some engagement around this, and these were the kind of barriers that we started to identify. So cultural, mental health issues aren't seen as important some of the times. Language barriers is a big one. So in a lot of Asian communities especially, there's no word for carer or indeed for mental health. So, it's not been discussed and is as prominent in those communities as some. Clinicians can have a lack of knowledge about things that are important to someone from ethnic minority backgrounds. So, being able to ask those questions about what is important to someone will really help them be able to support carers. White healthcare professionals are unable to fully understand what discrimination is like, lack of publicity about support available, still stigma about mental illness in some communities stops ethnic minority backgrounds seeking that help. One of the quotes we got from somebody just on the right there is, if they walked into their local mosque and told the imam I was feeling depressed or struggling with mental health issues, I would automatically be labelled clinically insane in the community, and that just kind of shows a little bit and highlights what we're kind of up against here in asking people to recognise their caring responsibilities and let us know about them so we can offer that support. So yeah, that was just a bit about the engagement. Just take us on to the next slide, please. So when we took this through a kind of task and finish group, and when we were discussing this, the group really felt strongly that managers, when they're faced with a new decision, and especially if the new managers some of the time, the first thing that they will do is turn to policy to see what's written there in black and white. And often with carers, we don't have specific carers policies, so they're referring to flexible working and special leave, usually, which don't have enough provision and enough flexibility historically, I might say, because they are definitely improving for managers to make those good sound decisions. So we started aiming at policy, but as we all know, policies take a long time to approve. So we've produced some management guidance instead to increase awareness of carers, because that is still an issue, is that people aren't fully aware of what carers are and what they do. Highlight those issues faced by ethnically diverse employees. Increase awareness of cultural and religious considerations in healthcare. Provide flexibility to carers and promote the passport, and increase the use of that health and wellbeing support for carers, like I say, to try and stop any crises arising. Next slide, please, Harriet. Thank you. So alongside the management guidance, we've commissioned a series of 3 webinars to increase awareness and showcase carer stories. Amplify carers' voices with case studies, so that they're available to other carers as well, to reassure them that positive things can happen. Senior champions, really important to get that senior support. So we got those speaking at the webinars as well, and we've targeted these at 1 at the VCSE networks, 1 at local authorities, and 1 at NHS trusts. We delivered those last week or the week before by the Race Equality Network, and I'm going to hand over to Shaheen now, who helped run those, and she's going to tell you about them.
Thank you, Paul. Next slide, please. So we delivered 3 webinars last week, bespoke for the local authority, the voluntary community sector, and for the NHS staff. The take-up was low for these, well, for me, somebody who's very ambitious, wanted to see 100 odd people turn up, and those were the attendees. But had we got a large audience, we wouldn't have had the intimate discussions and what had come out of these webinars. So If you go to the next slide, we'll just look at some of the common themes. Respite, this is what came out through all 3 webinars. Respite wasn't culturally sensitive. There was a lack of awareness of services and managers not being flexible. As Paul highlighted earlier, language barrier in accessing help seemed to come up again and again. Something that I clearly didn't know before about geographical boundaries and awareness of caring for a loved one at a distance, and have people thought about this in managers' places that they might have somebody. Myself, I was a carer caring for my mum who was 130-40 miles away. It wasn't something that I would discuss with my manager, but the stress that that would put on me when I was coming back to work, I just cared on a weekend. So it's something to be aware of, and how do we then support our staff? Something which came up time and time again about grief and loss and death. People from ethnically diverse communities, this is something that it's not talked about as often as it should be. Manual handling training. Somebody shared their experience that husband fell ill. Unfortunately, she had to then move her husband from the bed, wasn't given any training. By the time the training comes, she'd managed to do that, but it gave her a backache, and that put pressure on her physical well-being. So that's something that perhaps we can look at, or nationally, that do we provide manual handling training? If we don't, how do we do that in a timely fashion? Next slide, please. Some of the key recommendations is having to look at, and this is perhaps not just for around carers, it's probably around everything, mental health, having a single point of contact. There's lots of services, like for instance, earlier on, Wazir, you talked about individual coaching, spiritual and faith-based counselling. That was all new to me. For myself, when I was in a position, I absolutely needed that help working within the NHS. A referral gets made to occupational health. Our occupational health, these are something to think about. Do they have all the information to say, well, actually, this person is presenting in this way? Do we offer them the training, or do we offer them what they need? So it's something definite to be thinking about around cultural and religious issues affecting ethnically diverse staff. Another recommendation around respite, which meets the needs of diverse communities. And when we talk about respite, somebody made a very good, valid point is, I only want an hour so I can actually sleep for 1 hour. Somebody coming to my house who will understand the culture, my culture, rather than sending somebody else who does not get who doesn't speak the same language as my mother or father. So I think that was a real pertinent point. And I mean, last but not least, and there's probably many more recommendations that I can talk about, but I actually had 12 minutes, but there's something around developing a place-based carers network, or for us, I suppose we look at West Yorkshire-based network. And also there's something to think about. I did put up earlier on our West Yorkshire Healthcare Partnership, and I've put the page, and I'll do that again. I'll add the link. We've got some real good case studies from people. We've actually got GPs talking about being a carer. Is there something about people in very senior positions that they don't require the support, or they are resilient and they can cope with things better? So that's something else to be thinking about. And I think that's about all from me, but happy for questions, I think, towards the end. Thank you very much.
So thank you very much for sharing that great work that you've done. We'll be doing a Q&A section after the next presenter, who I'd like to introduce as Dr. Rekha Mitra. She's the CAMHS hire trainee and lead for Women in Medicine Carers Network, and she has an amazing presentation to share with us. So if I could pass you over to Dr. Rekha Mitra.
Rekha, you're on mute.
Hi everyone. Okay, I think I should be on now and you should be able to see me. So thank you so much, Monica, for that introduction, and thank you so much for organizing this, and for everyone who's attending, because we've got a great number attending, which is great. Just before I begin, I would just like to say that, what I'm presenting is a bit sensitive information, so please do not tweet any pictures of people on my slides and or any specific data that I'm presenting, which is basically one slide. But you, of course, can tweet about how brilliant the talk was and how fabulous the event that Monica and her team has organized. Thank you for that. Okay, so why are we today talking about this? Now, Carers UK in 2019 showed that 1 in 7 are juggling work and care in the UK. And at that time in 2019, they said that we had 250,000 carers working in the NHS. But the staff survey last year showed it's much more than that. It's 1 in 3 staff in the NHS have caring responsibilities. And Carers UK showed that it isn't 250,000, but it's 400,000 carers working in the NHS. Now, I know some of you are carers yourself in the audience, but it is important to kind of just go over a bit about who are carers, because as Carers UK, Helen Walker, who's the CEO of Carers UK, said that it takes a family member 2 years to recognize that they are carers, and probably even longer in case you're a parent carer. Now, carer is anyone, including children and adults, who looks after a family member, partner, or friend who needs help because of their illness, frailty, disability, a mental health problem, or an addiction, and cannot cope without their support. The care they give is unpaid. This is the definition from NHS England. Okay, so in 2019, Carers UK said that there are 5 million unpaid carers in the UK, and of them, 20% had given up work more than 10 years ago. So unpaid leave is what, and unpaid caring work is what characterizes carers. And we do get paid carers leaves, which kind of varies between 5 to 10 days across the UK. This again shows about most of the time we have to take unpaid leave, and basically what's important to remember is that carers leave is not an entitlement, so which means that you have to negotiate it with your line manager. It's not like annual leave that you can absolutely take it even if you have emergency caring happening. Okay, so that's says the same thing. Now, this is the data that I wouldn't like you to take a picture of at the moment. It is being published in autumn this year. This is among some women doctor carers in the NHS. This was only done in 45 of them, although we know that the numbers are in thousands. And so at that time, this was done in 2019, just an informal survey among women doctors, and we found that 66% continued to work despite their caring responsibilities, and out of that 16%, the partners had to give up work to support the women doctors in continuing to work, because social care support is as sparse for women doctors or any doctors as it is for the rest of the population. Among those who didn't work, 52% at that time, this is 2019 pre-pandemic, didn't have options for working remotely. So the chance of working remotely has really improved the situation, and 38% didn't work because of child's needs, because the child had too many complicated needs. Okay, so obviously this all leads to decreased progression and increased gender pay gap. We're talking about people who are carers with children with brain tumors, cancers, life-limiting conditions, rare diseases, autism, eating disorders, many more, and we're still working in the NHS. Now, you've already heard the brilliant presentation from West Yorkshire Partnership Trust, and Fatima shared this data with us, which I will share, which is that in their, they've done amazing work, and they found that 1 in 5 were juggling work and caring in their partnership trust. 80% hadn't talked about caring roles, and 50% were considering leaving their role for caring responsibilities. By supporting the carers within workforce, they made a business case that they could save £4.3 billion. Now, why does this matter? We know both sides of the table. We constantly deal with uncertainties. and it's important to think about what is NHS losing out by not retaining this workforce. This is just to say that, you know, in various roles, we are usually in leadership roles, and this experience of being a carer absolutely equips all of us here, including everybody in the audience who is a carer, for compassionate leadership, collaborative leadership, and resilient and transformational leadership. Because without self-leadership, it is impossible to navigate your life as a carer. So neglecting this hidden workforce is neglecting future NHS leaders. Now I'm going to quote one of my colleagues. She's a professor in psychiatry in US and is a carer herself and does lots of work for physician carers. And she said that doctors with caring responsibilities have significantly higher rates of mood and anxiety disorders and burnout when compared to other physician mothers. In US, they found that there were few policies that allowed paid family leave across a woman's lifetime. We are a bit better in the UK. But the best research that is that a change just in the leave policy alleviated depression among physician caregivers. And that's one of the motivations for presenting today, that, you know, if we are able to modify HR policies to become supportive of carers, that little bit is going to go a long way in looking after well-being of the workforce. Okay, so important to think that supporting carers absolutely is an equality issue, and whether in your own trust, are you doing enough for retention, well-being, and encouraging leadership of this very valuable workforce in the healthcare. So a group of us, we're all carers, got together, and we have we raise awareness together as Women in Medicine Carers Network, and we're very much supported by the recent changes world over. So UN resolution in 2021 absolutely made resolution to promote and protect rights of those with rare diseases and their families. This is a good start, although everyone who's caring for somebody with great needs is not necessarily rare diseases. GMC strategy recently has said that, so this is General Medical Council, applies to the doctors, that it recognizes doctors with caring responsibilities and supports flexible working, although this is yet not mandatory. And we were hoping to hear from Commitment to Carers, Jen Kenwood, who unfortunately couldn't attend, but of course her reason is very understandable. And a clinical fellow has been appointed recently, so we look forward to, you know, more work in supporting workforce there. Most of the work so far, I believe, has been patient focused, which means carers of patients. So now, does one size fit all? Carers Passport, as we heard about it, is a great initiative. However, healthcare jobs have different hours and risk responsibilities. And I'm just going to highlight just what's happening with the doctors. So in the primary care, you have lots of GPs in one surgery. In tier 3, like in community services, like I'm in camps, so that's community, you have one consultant per team, maybe 1 or 2 junior doctors. In inpatient, you have one consultant per unit, maybe 1 or 2 junior doctors. Most consultants and junior doctors have out of hours work, and clinical risk responsibility absolutely lies with the doctors. So this makes it a very complex challenge when you want to support carers among them. Doctors' jobs pose maximum challenge for supportive work arrangements. And if you're able to support your medical staff, doctors and nurses, you will certainly be able to support all clinical staff, allied healthcare staff, and admin staff. So we're a network, Women in Medicine Carers Network. All we hope for is a carer confident NHS. And, you know, we propose ourselves as an expert panel, happy to collaborate, happy to think through, to think how we can make it a better and supportive NHS, which looks after its own staff. So although we call ourselves Women in Medicine Carers Network, it's not just for women, it's not just for doctors, but we think it's a start. So that pretty much ends my slides. Thank you.
Monica, I think we're moving on to the Q&A now from the chat box following the presentations.
Yes, sorry, I thought you were going to put the slides back up. That's fine. So there are a few questions that were put in the chat box. Could one of you put them forward, Kelly?
Yes, yeah. The first question here is, how do you get an ESR passport for carers? Paul, maybe your team might want to answer this.
Yeah, I can certainly cover that. Thank you, Kelly. Yeah, so the ESR passport is a Carers UK product. So it's with the registered charity Carers UK. All the ICSs are registered as employers with Carers UK and have access to what they call the Digital Resource for Carers, DRC. So if you haven't already got it in your organisation and you are either NHS, local authority, VCSE covered by an ICS, then your ICS should have access one way or another. It is tailored to the area that you're in though. So our codes in West Yorkshire are different to those in other ICSs, and it will link carers to support in their area. So all ours link to the VCSE organisations in West Yorkshire. So I'd approach your ICS about the carer's passport if you haven't got it already. In terms of ESR, this was a temporary method implemented pre-pandemic, I think, which isn't ideal, but it's done through the competencies in the learner record. So there are competencies loaded into ESR, which is national, so they're in everybody's ESR, that you can tag a working carer and a working carer passport holder on as competencies. That then, when you run reports, you're able to see how many people you've got in each area. I think we've posted some links to the guidance for that as well, and I think that's in the chat somewhere, but I can provide those if people don't have them.
There's another question to follow that's come up regarding ESR, which is where do you record carer status on ESR?
So like I say, that is a competence at the moment, like the statutory mandatory training record is. So where you've got your data awareness training and your health and safety and your fire, it's in that record, that same record. There are competencies that you can go on as an employee and add, or if you are line managing people, you can add them on as well through conversations. They are working on improvements to that in the ESR national team. Hopefully it's going to be on the portal page and a lot easier to access for employees. At the moment it is a little bit clunky, and we have had that feedback from carers as well, but we are, like I say, aware of it.
Thank you, Paul, for that. The next question is, how trusts are managing a career passport and a health passport? Have you merged them, or are they separate?
Yes, I saw that pop up in the chat, and it was interesting. So, and I think somebody had put in there that they had merged them but called it a wellness passport or something along those lines. So two things. I think your health passports are about your health, and often, you know, where you're using that passport for a condition that you might have that requires a certain amount of flexibility, I think that's fine. You could merge it with a carer's passport, but I think they do two slightly different things. And in terms of it being on a health passport, I think we'd have to, like you have with the one that came back in the chat, make it clear that it's not just about your health. Generally speaking, you know, no two carers are the same. The most common form, I'd say, of caring is for elderly parents. Those caring journeys tend to progress, you know, as conditions deteriorate. So they change all the time. They require regular review. But it's not rigid, I suppose is the bottom line. You know, if it seems like a sensible way to go to me, to merge them together, call it something else, and you can do two things with that one passport. Otherwise, I'd just be kind of mindful that one's about your health and one's about your caring responsibilities as well, and just being able to provide that delineation between the two of them, I suppose.
Thank you, Paul. That's really interesting to sort of find out what's going on. another question. This is open to everybody, really, all the presenters. Are you aware of any changes to carers' rights upcoming in the next year, or anything else happening to the carers' rights?
Paul, is there something around the statutory, they're trying to make it statutory 5 days paid, unpaid, taking off leave, and is that something they're trying to make statutory?
Yeah, so in terms of kind of legislative stuff, I don't think there's a lot coming in the way of carers. I'm certainly not aware of any. There's new flexible working changes, which I think providers are still working on. So there's now a day one right to request flexible working, whereas some had it after probationary period or after a year of service. And now multiple requests can be made per year. So that's on the flexible working kind of slant on it. But I can't think I'm particularly aware of anything legislative coming for carers. I mean, it has been discussed about including it in the Equality Act as a protected characteristic. But I don't think that's been produced into a white paper or anything like that at this point. But those conversations are going on. But aside from that, I can't think I'm aware of any. No, I don't know if colleagues are.
Anybody? No? Okay, I'll just ask one more question. Do you think COVID has helped or made things difficult for carers?
The feedback that we've got is overwhelmingly that it's made it a lot more difficult in terms of the financial pressure that it provides, in terms of the time it takes to care. Carers are now providing more care in terms of hours. They're providing more care in terms of financial support. What they saw through the pandemic was a lot of local services closing as well, so that made it even more difficult to make journeys and live life quite where it's at in terms of recovery of that. Not 100% sure, but it's certainly provided additional pressure to carers through the pandemic, yeah.
Okay. Thank you, team. Thank you, Paul. Monica, over to you.
I think I've got one question as well. I've heard talk of carers becoming one of the protected characteristics, and I wondered if you were able to update on that, or is that the case, or is it more of a rumor?
I think there is some provision for it, Monica, in the Equality Act as it is at the moment, but it's just not named as one of the 9 protected characteristics. Where we've been having those conversations, it's been more around the, I suppose, weight that it would carry if it were a protected characteristic, you know, being a beneficial effect than anything else really. But I'm not sure, you know, kind of where that conversation's up to in terms of, you know, pushing for that result.
There are some trusts who are actually looking at it as a protected character, although it's not official, but the way that they support their staff is that it is a protected character, so we will then provide you all the support, and those are, I always say that those are the people who are ahead of the game. So we know that there is definitely one NHS organisation who is doing that at the moment.
There is someone who's got their hands up. Could I ask if you could put your question in the chat box very quickly? We've got another minute or two, and if there are any other questions, now's the time maybe to put them in the chat box. And Raka, if you've got anything you want to add, of course, please do speak up.
So Esther, you've put a question in there about what's an ICS. So the ICS are integrated care systems. They're replacing the CCGs that were. So in your area, you should have either CCG bodies or now in the ICS. I'm not sure 100% what they'll be called in your area. But if you want to drop me an email, I can help you out with that.
Yeah, there was a question about staff that are caring for family with long COVID, and I think one of my colleagues has dropped some guidance in there. I don't know if there's anything more you would want to add to that. There's so many things coming through. We'll download these afterwards, and if we can do any more, we'll get back to you guys. So for the practicalities of time, we've come to the end of the presentations, and I just wanted to ask about some evaluation level questions. So just some Menti questions. Again, it's the same information in terms of the code. If you could put the next slide up. So it's menti.com 80792379 as before. So what is the one word to describe how you found today's session? Informative seems to be up there. Useful, interesting. I'll have to give it a little bit more time for people to add in. Informative seems to be the most interesting one as the other one. And then I've got one other question, which is, if we can move on to that. What is the one thing you will take away to support working carers in your organisation? Explore passports. There has been quite a lot of discussion about that in the chat. New resources. Try to push for better leave policy for carers. Resources again has come up. Managers to be better trained and informed. So stuff around line management, connecting with ICSs. A bit more about passport and guidance. HR teams, raise awareness. Work closely with EDI and faith leaders. That's interesting. Passports and guidance again. I think this has been very informative in terms of the carer's passport. Staff networks are always a good means to share these messages. I think someone just posted that in the chat.
I think I'll just add one thing, that carer's passport may not be applicable to all kinds of employees, and hence it's really important to ask the question how you are and whether you are taking care of somebody. And I really hope that you would also ask your clinical colleagues how they are. Thank you.
So there's a lot for us to analyse and share. I'd like to thank our speakers for these excellent presentations. It's created a lot of discussion, a lot of information. And I also wanted to let you know that our next session in October will be themed around Black History Month. So I'd encourage you to register. Someone will drop that into the chat, the registration link for that. One of my colleagues, I hope. The slides, the majority of the slides, bar Dr. Raka Maitra's, will be shared. And it's just to let you know that we've got this new learning hub. It's an inclusive learning hub, and the recording and the slide will be shared there. So what we're planning to do is invite you, because as this name of this group suggests, it is a community of practice. So we'd like the learning hub to be a place where people can talk to each other, can look at good practice. So we'll be sending around that invitation to that Futures site, which all NHS staff access. And if you don't wish to engage with that, that's absolutely fine. You have that option. But again, thank you so much to our presenters for these excellent presentations, and all the hard work that you've done for this, and my team, of course. So I don't know if my team want to come online to show themselves, to say hello to the audience before we go off. So there we go, everyone's giving us the waves. So thank you, the audience, for your attendance, and I hope that we can continue and extend our community of practice, as I said, via our Learning Hub and our future sessions. Thank you very much for your time.
Thanks, everyone.
Bye-bye.
Thank you. Thank you so much.